What is CIN1, CIN2, and CIN3 in cervical cancer? Imagine your cervix as a tiny gateway between your womb and your vagina. Sometimes, cells on its surface can change in ways that aren't normal. These changes are called cervical intraepithelial neoplasia, or CIN for short. They are not cancer yet, but they are considered precancerous, meaning they could develop into cancer if left unchecked. Doctors grade these changes from 1 to 3, based on how much of the surface layer is affected and how abnormal the cells look under a microscope. CIN1 is the mildest form. It means about 1/3 of the surface layer has abnormal cells. Usually, these changes are called mild dysplasia. The good news is that CIN1 often goes away on its own without any treatment. Doctors typically recommend watchful waiting with regular Pap tests or colposcopies to see if the abnormal cells resolve naturally. This approach helps avoid unnecessary procedures and allows the body to heal itself in many cases. When the abnormal cells extend through about 2/3 of the surface layer, it is classified as CIN2. This indicates a higher level of abnormality called moderate dysplasia. CIN2 carries a greater risk of progressing to more severe changes or even cervical cancer if not managed properly. Depending on the situation, doctors might choose to monitor closely with repeat biopsies or recommend removing the abnormal tissue through procedures like a loop electrosurgical excision. If CIN2 persists beyond 1 or 2 years or shows signs of worsening, treatment is usually advised to prevent progression. CIN3 is the most severe precancerous change. It involves abnormal cells affecting the entire thickness of the surface layer, which is why it is sometimes called carcinoma in situ. Despite the name, it is not yet invasive cancer because it hasn't spread deeper into tissues. However, because CIN3 has a high chance of developing into invasive cervical cancer, if untreated, prompt treatment is essential. Usually, doctors recommend removing or destroying these abnormal cells, especially in women who are not pregnant. In pregnancy, management might be more cautious, but treatment remains important to prevent future cancer development. Understanding these grades helps healthcare providers decide the best course of action to prevent cervical cancer. Regular screening with Pap tests and follow-up are key to catching these changes early. Remember, each person's situation is unique, so if you receive a diagnosis of CIN, it's important to discuss your options thoroughly with your healthcare provider. They can guide you on the most appropriate management based on your individual health and circumstances.